This is Jaxxon. He's a 1-year-old shepherd mix. I've just given him a new toy that he's very, very enamored with, because our orphans don't get toys often enough. Jaxxon, until he was diagnosed with hip dysplasia, played in camp with all the dogs. He was a wonderful camp participant. He played and never misbehaved. He could play with big dogs and little dogs. Jaxxon, you have to face the camera. Oopsie daisy. Here we go. Here we go. If we're going to be on film, we have to look at the camera. So Jaxxon was in camp. He was going on long walks with volunteers, and then he was diagnosed with hip dysplasia, which you will hear more about, at which time his activities became much more limited. He can go on short walks with volunteers, but he can no longer go in camp to play with all of his friends, which is very sad, because he would like to be running, jumping, and playing with friends and going on very long walks with volunteers. He loves all people. He likes kids, strangers, men. This is an all-round, perfectly wonderful dog. He just has to have his hip dysplasia corrected, or he will be forced to have limited activities for far too long. That's all I can tell you about him, except that he's a precious boy. Did you notice his little crossed paws? Isn't it darling when dogs do that? They just look like debonair gentlemen.
Hi, I'm Dr. Munson. I'm here with Jaxxon at the East Lake Pet Orphanage. Jaxxon is one of our orphans. He's a 12-month-old German Shepherd. He came to us a few months ago. A Good Samaritan found him running around in the country. When he came to us, we noticed that he had an abnormal gait where he was kind of bunny hopping, and he had a little bit of sway in his back end. And when we took some x-rays of his hips, we diagnosed hip dysplasia. Now, hip dysplasia is where the ball and socket of the hip joint don't fit together very well. And that kind of laxity can cause some bone-on-bone grinding and cause some arthritis. What are you doing, Ben? Can cause some arthritis to build, even from a really young age like Jaxxon. Now, some of these dogs can be medically managed. In Jaxxon's case, he is pretty severe. There is a lot of laxity in that joint, and he's starting to build arthritis already in the x-rays. So he's going to require some surgery to be done. And the surgery, thankfully, we have a donation from Paws to help us get done one side. And the surgery is going to be removing the femoral head, so the ball of the joint, to create a false joint and remove the source of pain, that bone-on-bone rubbing. This is a set of the most recent x-rays on Jaxxon here. And as you can see, this is the femoral head, and that's the ball of the joint, and then the acetabulum right here. And as you can tell with Jaxxon's, his are really not sitting close to that socket. And they're a little bit irregular shaped, and you can almost see a little bit of arthritis being built already. In normal hips, you should have almost 50% coverage of that femoral head by the acetabulum, and they should kind of fit like a nice glove. With Jaxxon, there's barely any coverage on one of his legs, and that's a great source of pain, and that ball can kind of just move wherever it wants and cause some rubbing with the other bones and cause some arthritis there. We were waiting for him for his bone feisties, so his bone plates to close before we could do the surgery. So we do it too early. Sometimes that femoral head likes to grow back. But now he's at the time in his life where we can do the surgery and we can intervene with this disease. Dogs that have this surgery do really well afterwards. They can usually be maintained on some supplements afterwards and a good diet and keeping them at a good weight, and they do fabulous. They can run again, they can swim, they can do all kinds of things. So if you'd like to come meet Jaxxon or donate to his cause, we'd really appreciate it to help with that other hip. That'd be great. Thank you.